You check your blood sugar first thing in the morning, and the number is higher than you expected. You ate a careful dinner. You took your medication. You didn't sneak a midnight snack. So why is your fasting blood sugar elevated? If this sounds familiar, your morning coffee might be playing a role you didn't know about. I'm going to explain exactly how coffee can affect blood sugar in the morning, why some people are more sensitive than others, and what you can do with this information to make better decisions for your own health. I'm a board-certified physician with over 20 years of experience helping patients manage their blood sugar. And one of the most common questions I hear from people over 50 is this: Doctor, why does my blood sugar spike after my morning coffee even when I don't add sugar? It's a great question, and the answer isn't what most people expect. This isn't about coffee being good or bad. It's about understanding how your body responds to caffeine, especially in the morning when your hormones are already working in ways that can raise blood sugar. By the end of this video, you'll understand the science in simple terms, you'll know what patterns to watch for, and you'll be able to have a more informed conversation with your own doctor about whether your morning routine might need a small adjustment. Let's start by talking about why morning blood sugar is so sensitive in the first place. Your body has a built-in alarm clock. Between roughly 3 and 8 in the morning, your body releases hormones that prepare you to wake up and start the day. These hormones include cortisol, growth hormone, and adrenaline. Their job is to give you energy, and one of the ways they do that is by signaling your liver to release stored glucose into your bloodstream. This is completely normal. It happens in everyone, whether they have diabetes or not. In people without diabetes, the pancreas releases just enough insulin to handle that glucose release, and blood sugar stays stable. But in people with diabetes or prediabetes, that insulin response doesn't work as well. The glucose builds up, and by the time you wake up and check your blood sugar, it's higher than it was when you went to bed. This is called the dawn phenomenon, and it's one of the most common causes of high morning blood sugar. Now, here's where coffee comes into the picture. Coffee contains caffeine, and caffeine is a stimulant. It doesn't just wake up your brain, it also stimulates your adrenal glands, which sit on top of your kidneys. When your adrenal glands are stimulated, they release more cortisol and adrenaline. These are the same hormones your body was already releasing naturally to wake you up. So when you drink coffee first thing in the morning, you're adding more fuel to a fire that's already burning. Your liver gets an extra signal to release more glucose. And if your body's insulin response is already struggling to keep up with the natural morning rise in blood sugar, adding coffee can push it even higher. This doesn't happen to everyone. Some people can drink coffee all morning and never see a change in their blood sugar, but many people, especially those over 50, do notice a difference. And the reason has to do with how sensitive your body is to caffeine and how well your pancreas is still able to produce insulin in response to rising blood sugar. As we age, insulin sensitivity tends to decrease. That means your cells don't respond to insulin as efficiently as they used to. Your pancreas has to work harder to produce more insulin to get the same result. And if you add a stimulant like caffeine into the mix, especially on an empty stomach, it can tip the balance in a way that raises your blood sugar more than you'd expect from a drink that has 0 carbohydrates. Let me explain the timing issue, because this is something a lot of people don't realize. When you drink coffee immediately after waking up, your cortisol levels are already at their peak. Remember, your body has been releasing cortisol since the early morning hours to help you wake up. Drinking coffee at that moment adds even more stimulation on top of hormones that are already elevated. Some research suggests that drinking coffee 30 to 60 minutes after waking, rather than immediately, may reduce this compounding effect. By waiting a little bit, you give your cortisol levels a chance to start coming down naturally. Then, when you do have your coffee, the stimulant effect isn't piling on top of an already elevated stress response. Another important factor is whether you're drinking coffee on an empty stomach. When you drink coffee without food, especially black coffee, the caffeine is absorbed very quickly into your bloodstream. That rapid absorption can trigger a stronger cortisol and adrenaline response, which means a bigger glucose release from your liver. But if you have a small amount of protein or fat with your coffee, like a handful of nuts or a piece of cheese, the absorption slows down. The caffeine still gets into your system, but more gradually, and that gentler, slower release may result in a smaller blood sugar spike. This isn't a rule that works for everyone, but many doctors recommend trying it to see if it makes a difference for you personally. Now let's talk about some common mistakes that seniors often make with their morning coffee. Not because they're doing anything wrong, but because they simply don't have this information. The first mistake is assuming that because coffee has no sugar and no carbohydrates, it can't possibly affect blood sugar. That assumption makes sense on the surface. But as we've discussed, coffee affects blood sugar indirectly through its impact on stress hormones. It's not the coffee itself raising your blood sugar. It's the hormonal cascade that caffeine triggers. The second mistake is drinking multiple cups of coffee in the first hour or two after waking. Each cup adds more caffeine, which means more stimulation of your adrenal glands, which means more cortisol, which means more glucose release. If you're someone who drinks 3 or 4 cups of coffee before 9 in the morning, and your blood sugar is consistently high during that time, it's worth considering whether spacing out those cups might help. Again, this isn't medical advice. It's just a pattern that many doctors see in their patients. The third mistake is ignoring other factors that amplify coffee's effect on blood sugar. Poor sleep, chronic stress, dehydration, and certain medications can all make you more sensitive to caffeine. If you only slept 4 hours last night, your cortisol levels are already elevated from stress and fatigue. Adding coffee on top of that creates an even bigger hormonal response. If you're dehydrated, your blood sugar tends to read higher because there's less fluid in your bloodstream to dilute the glucose. And if you're taking certain medications, like steroids or some blood pressure medications, those can also interact with caffeine in ways that affect blood sugar. None of this means coffee is dangerous. It just means that coffee doesn't exist in isolation. It's part of a bigger picture that includes your sleep, your stress, your hydration, and your overall health. So, what do many doctors recommend considering when it comes to morning coffee and blood sugar? First, pay attention to timing. If you always drink coffee the moment you wake up, try waiting 30 to 60 minutes and see if you notice a difference in how you feel or in your blood sugar readings. Some people find that this simple shift makes a noticeable difference. Others don't. But it's worth trying for a week or two to see how your body responds. Second, consider having a small amount of food with your coffee. It doesn't have to be a full meal. A spoonful of peanut butter, a hard-boiled egg, a small piece of cheese. Anything with a little protein or fat to slow down the absorption of caffeine. Again, this isn't a prescription. It's just a strategy that some people find helpful. Third, monitor patterns rather than obsessing over individual numbers. If you check your blood sugar after coffee one morning and it's a little higher than usual, that's not necessarily cause for alarm. But if you notice a consistent pattern where your blood sugar is significantly higher on mornings when you drink coffee compared to mornings when you don't, that's useful information. You can bring that information to your doctor, and together you can decide whether it makes sense to adjust your routine or your medication timing. Fourth, consider the amount of caffeine you're consuming. A small cup of coffee has less caffeine than a large cup. A light roast has more caffeine than a dark roast. If you're drinking very strong coffee, or if you're drinking multiple cups in quick succession, you're getting a larger dose of caffeine, which means a larger hormonal response. Some people find that switching to half-calf or reducing the size of their morning cup makes a difference without requiring them to give up coffee entirely. Now, let's talk about individual differences, because this is critically important. Not everyone reacts to coffee the same way. Some people metabolize caffeine quickly. Their bodies break it down and clear it out within a few hours. Other people metabolize caffeine slowly. It stays in your system longer, which means the effects last longer. This is determined partly by genetics and partly by factors like age, liver function, and medications. If you're a slow metabolizer, even 1 cup of coffee in the morning might affect your blood sugar for several hours. If you're a fast metabolizer, you might not notice any effect at all. Age also plays a role. As we get older, our bodies often become more sensitive to stimulants. The same cup of coffee that didn't affect your blood sugar at age 30 might have a noticeable effect at age 60. That's not a sign that something is wrong with you. It's just a normal part of how metabolism and hormone sensitivity change over time. Sleep quality matters too. If you're not sleeping well, your body is under more stress, and you're more likely to have an exaggerated response to caffeine. Chronic stress has the same effect. If you're dealing with ongoing stress, whether it's from health issues, family concerns, or anything else, your cortisol levels are already elevated. Adding coffee on top of that can amplify the blood sugar response. Medications can also change how your body responds to coffee. Some diabetes medications work better when taken at certain times relative to meals and coffee. Some blood pressure medications interact with caffeine. If you're on any medications, it's worth having a conversation with your doctor or pharmacist about whether the timing of your coffee matters in relation to when you take your pills. I want to emphasize something important here. None of this means that coffee is bad for you or that you need to give it up. Coffee has been studied extensively, and for most people, moderate coffee consumption is associated with several health benefits. It's rich in antioxidants. Some studies suggest it may be linked to a lower risk of certain diseases. The point of this video is not to scare you away from coffee. The point is to help you understand that coffee can affect blood sugar in ways that aren't always obvious, especially in the morning, and especially if you have diabetes or prediabetes. If you love your morning coffee and you're not noticing any problems with your blood sugar, then there's no reason to change anything. But if you've been frustrated by unexplained morning blood sugar spikes, and you've been drinking coffee on an empty stomach right after waking up, it's worth experimenting with timing, portion size, or having a little food with your coffee to see if that makes a difference. Let me also reassure you about something. High blood sugar in the morning doesn't mean you're failing. It doesn't mean you're not trying hard enough. The dawn phenomenon is a physiological process that happens because of hormones, not because of anything you did wrong. And if coffee is contributing to higher morning readings, that's just information. It's not a judgment. It's something you can work with. You can adjust timing. You can adjust amount. You can talk to your doctor about whether your medication timing needs to be tweaked. But you're not doing anything wrong by drinking coffee. You're just learning how your body responds to it. One more thing I want to mention is hydration. Dehydration can make blood sugar readings appear higher because there's less fluid in your bloodstream to dilute the glucose. Coffee is a mild diuretic, which means it can increase urine output slightly. If you're drinking coffee first thing in the morning and you haven't had any water yet, you might be mildly dehydrated, and that can contribute to a higher blood sugar reading. Some people find that drinking a glass of water before or with their coffee helps. It's a small, simple habit that costs nothing and might make a difference. Let me summarize the key points so you can remember them clearly. First, morning blood sugar is naturally higher because of hormones your body releases to wake you up. This is called the dawn phenomenon, and it's completely normal. Second, coffee contains caffeine, which stimulates the release of more stress hormones. And those hormones can signal your liver to release more glucose into your bloodstream. Third, drinking coffee on an empty stomach immediately after waking may amplify this effect. Fourth, not everyone reacts to coffee the same way. Your age, genetics, sleep quality, stress level, and medications all influence how your body responds. Fifth, if you're concerned about morning blood sugar spikes, consider experimenting with timing, portion size, and having a small amount of food with your coffee. And sixth, always discuss any changes or concerns with your doctor, because what works for one person might not be right for another. This video is for educational purposes only. I'm not your personal doctor, and nothing I've said here is meant to replace the advice of your healthcare provider. If you have diabetes or prediabetes, your doctor knows your complete medical history, your medications, and your individual needs. Before making any changes to your diet, medication timing, or routine, talk to your doctor. What I've shared today is general information to help you understand how coffee might be affecting your blood sugar, so you can have a more informed conversation with the person who knows your health best. I'd love to hear from you. Have you noticed changes in your morning blood sugar after drinking coffee? Do you drink your coffee on an empty stomach, or do you have it with breakfast? Have you tried adjusting the timing and noticed a difference? Leave a comment below, and share your experience. Your insights might help someone else who's dealing with the same questions. And if you found this video helpful, consider subscribing to the channel. I create content like this regularly to help people understand their health in simple, practical terms. Thank you for watching, and I'll see you in the next video.